Hello, you're welcome to my channel. If today is your first time of joining us, nice to meet you. Today we're going to talk about top tips for appearing for ACF interview. ACF means Academic Clinical Fellowship, and it's for doctors and dentists who are interested in both specialty training as well as research training. So there are phases to ACF application. One of those is to apply through the normal ORIA routes. And if you're deemed eligible for interview, you are now invited for the interview. The interview will seek to ask you questions on different things. And I've tried to collect information from existing and current clinical fellows, academic clinical fellows who have tried to describe their experience and what they did before the interview. So if you're preparing for academic clinical fellowship interview, this video is for you. Sit tight. So I'm just going to read from the screen. You might not see where I'm reading from, but I will make sure I'm audible enough, and so that you can follow with the questions I'm going to be reading out. So these are questions I asked a number of academic clinical fellows, and I'll read out the response in the way they have itemized them. If there is any reason for me to add on to that, then I will lay my own experience. I would include that in this video. So sit tight. Okay, so the first question I asked was about resources that the my colleagues used in preparing for their ACF interview. So the question is, what specific resources, books, websites, courses did you use to prepare for your ACF interview? And the answers included NIHR website, ACF Fair Choice, online subscriptions. I haven't even heard about this one, but you can see someone had used ACF Fair Choice online subscription. You might Google it and see if it's there. And the other answer was how to succeed in a clinical academic interview, and it's on Amazon. So if you've got time, Google on Amazon a book on how to succeed in a clinical academic interview. So that might help you in preparing. So there's this other answer about I used the questions guidance on the NIHR website. Okay, it has been said before. Prep answers for area. The medical interviews book by Picard et al. Is very useful, and the official guide on the NIHR resources and practice for peers. Remember, these are opinions from colleagues. It's not from NIHR or from the recruiters. So I'm just trying to collate the information from my colleagues, which can be useful to anybody at all. So just know that. So the next question is, how did you structure your interview preparation? Yeah. So in terms of timeline, daily routine, practice sections, and the responses included PRN. So whenever I have the chance, it's difficult with a full-time clinical job. Of course, you are dying with other commitments, so you have to prepare with that in mind. So there is this other response: increase preparation in the course of in the couple of weeks preceding. So before the interview, this fellow try to increase their prep, which is expected. This other colleague said, I was in a full-time NHS job, so time was a challenge. From the point of shortlisting, I will stay back after work from 5 p.m. to 6 p.m. to practice. So you need to find out what works for you. But the important thing here is that you need to put in some time to practice for your interview. Okay, so the next question was, did you attend any interview preparation courses or workshops? If yes, were they helpful? So an answer said, yes, a workshop helpful in that I experienced how questions are expected to be answered. Okay. The other person said, no, I did not attend any workshops. The other person said, no course per se, attended a mock prep with Dr. Carlo and another team. Those two practices was very engaging and it marks out. So I do support candidates with mock preparation. Apparently, this fellow benefited from our mock preparation section. So if you want to go through our mock sections, that's also fine. We can support you with that at the Stick Academy. Thank you very much for this fellow who has testified about the things we do at the Stick Academy. Okay, so next question is, what's the one piece of advice you give someone preparing for an ACF interview? Okay, so here are the comments. Make sure your goal aligns with your prospective supervisors. Second answer said, practice answering curveball questions. You're likely to get one, and it's helpful to be anticipating this. So I just looked up what curveball questions mean, and the dictionary says is something unexpected. Usually in the interview, some of the questions are predictable because NIHR has a guideline of the sort of questions that can be asked. But this fellow was like, it's possible to get something unexpected from the list of the guideline NIHR has provided. Okay, so the next question is, how important is it to identify a potential supervisor through project before applying or interviewing? The first response says very important. It helps you understand the organization's vision and gives the team a chance to know you too beforehand. I sort of agree with this. During my time, I did get in touch with the PIs of the project I'm currently following, and it really was helpful because during the interview, I didn't need to say much. One of the panelists actually even mentioned that we've met before during my own time. So I do agree with this responder that yeah, it's very important. So the second response is highly variable depending on that particular ACF. So which is also legit. There are also colleagues who haven't made contact at all. And I think it's important to know that if you do have opportunity to have informal conversation with your panelists or the PIs, that's a good thing. But if you don't, it's also variable. It doesn't necessarily mean that you won't get it. So the last response here said, not important. If you impress the panel on the interview, you'll be selected. So you can see that we have a range of response here. Some colleagues think it's very important. I am in that category. I think you should make contact with your potential PIs and all that to understand, because one of the questions you might be asked would be your understanding of the specific project that that the ACF is meant for. And one of the ways you can do that maybe in a number of ways. One of the ways could be to read on the internet what they have posted there. The other thing is to actually speak with the PIs to now understand what is going on within those projects, which was what I did. But as you can see, it's varied. Some might choose to, some may not, but it depends. Particularly what the last person mentioned here, if you impress the panel on the internet on the interview, you'll be selected. I think so too. If even if you have made contact with them prior to the interview, if there's a better candidate on the day, that better candidate would take up the posts. I can assure you. Did you practice mock interviews? That's the next question. If yes, with whom and how many sections? Example, colleagues, mentors, mock panels. So the first response said, not really a mock interview, not really a mock interview, but I had my answers scrutinized by ACFs. So this candidate or this fellow had prepared their answer and asked other current fellows to have a look at that. So it's something you can also do. I didn't think about this and I didn't do that. So this other said yes with a colleague. For me, I did a number of mocks. I did with a colleague. I did with a fellow who was already in the program. Who else did I did with a senior colleague who is a consultant. Who else? I did with my wife. from a layperson's perspective, which I think added to that. I also did with another current fellow. So I'm thinking about, did I talk to three fellows or so? But the important thing is that I had opportunity to do a mock interview with current fellows, and it was very helpful. So this other person said I did with Dr. Carlo and another group of friends. So because someone generously or people generously did this sort of things with me, so I felt that it's something important to give back to others. So that's why at Estuk Academy we keep on supporting fellows, and some people have gone ahead to find that useful, and they're also current fellows. So I'm so happy that we've reproduced other fellows since the time I became a fellow. Okay, so the next question is, how did you handle nerves or tricky questions during the interview? Of course, there's no interview that you wouldn't have nerves. You usually will be anxious because just because it's an interview, even if you think you've prepared well. So it's important to also talk about how do we handle nerves when we are presenting, when we are in an interview situation. So this candidate said, I used lived experience to answer them. Slowing down can also give one time to think and formulate a reasonable response. So giving examples from your lived experience and slowing down. So if you think that the questions are something out of the blues, just slow down and think. So this other fellow said tricky questions did come up. It's okay to take a pause and think and come back to a structure. Sometimes people think that you need to just give it back to them back to back. No, if you ask a question in the interview and you think that this question is difficult, pause a bit. It's okay to even ask them back the question, do you mean this? Or let me just have a think about it. It is not going to detract anything from your answer, so far as you finally provide the right answers they are thinking about. So it's even worse that you haven't thought about it and you are just providing the wrong sort of answer. It means that you're not reflecting back the answers to them the way it should be. So the other respondent said practice awkward situations or questions. So it's a bit about practicing questions. Um, Usually, one of the questions that they would ask in ACF interview would be around recent research paper you've read that is not exactly in your area of interest. Why did you read it? What are the things that you learn from it? So sort of trying to see if you have diverse interests or you can read widely, not just in your area of research interest. So sometimes people find different things they want to say about it. In my own situation, I coined a life story, a lived experience story, really, about a relative of mine who was supposed to undergo a glaucoma surgery, and there was this sort of um, disagreement whether to go on with medical treatment or surgical treatment for glaucoma. So, and they looked at me and was like, "You're the doctor in in the family. So, what's your advice?" So that made me to begin to look at documents around evidence around surgical stroke medical treatment of glaucoma, and so I read around it and discussed that to the panel, and that resonated with the panel because it's a practical experience of what was going on in my family at that point in time. And actually, what about that day panel was, how is this your relative now? Which one did you finally take? Was there any improvement? So, so I think that sometimes what you finally would talk about is okay to share your life experience and also to practice ahead of time because you know you're likely going to be asked that question. So practice it ahead of time. So let's move on to the next question that says, looking back, is there anything you wish you focused on more during your prep? The first responder said, not really, but always good to practice well ahead of time. So we can't overemphasize on this practice because you're going to be speaking to people and you need to appear very sharp and very articulated in your presentation. So questions come up on areas that were relevant to academia but didn't necessarily appear on the NIHR standard prep questions. It would have been useful to be a little more prepared for this. So while it is there is a guidance for panelists to go through the standard questions from NIHR what's it called website. So, but there might be some slight differences, like this current fellow mentioned here. So this other person said, I wish I had the time to start earlier, but no point because I still got it. Glory to God. Yeah, so it's okay to start early. I think usually you'll be notified if you're shortlisted for interview like 1 week before the interview date, and 72 hours before the interview, you get your data set that you're going to be discussing in the interview. So you don't really have a long window to prep for it. But if you have applied, I think it's good to, even if it's not a very detailed preparation, but still start warming up, looking at the questions that might be asked. So the next thing here is, were there any specific documents you found indispensable for prep? Example, NIHR guidelines, special specific information. So the response were all tending towards the NIHR interview questions, and NIHR interview questions. It's on their website. So if you open up the website for ACF adverts on NIHR website, you will see on Appendix 6, you will see the specific questions that they're going to ask, or the standard question they're likely to ask for an ACF interview. So we're going to be discussing those specific things and how you may be able to respond to them in the next video we're going to do. So, but this is just to prepare your mind on how you can go about it. So, like you already have seen here, all these colleagues have mentioned that that's a go-to. So, if you haven't looked at those guidelines, then you have to, because that's what you use. It's a template for you to prepare. So, I hope that these tips are relevant to you and will be useful to you. If you do have any other questions that you want to ask on how to prepare for your ACF interview, please drop it on the comment section and I'll be happy to respond to those. And like I said, in our next video, we are going to look at the various items, the various questions on Appendix 6 of the ACF interview template, how you can respond to them. See you in my next video. Thank you very much. Bye for now.